time, Chair recognizes Councilwoman Blackwell, who presents a resolution honoring Dr. Arthur C. Evans. Would Dr. Evans and those accompanying him please join the Councilwoman at the podium? And joining the Councilwoman, we have Councilman Greenlee, Councilwoman Reynolds Brown, Councilman O, and I believe Councilwoman Bass, Councilwoman Gim, and Councilwoman Dom, and Councilwoman Parker. I'm sorry, Councilman Dom. I'm sorry. Sorry, Councilman. You do not look like a woman. And Councilman Taubenberger. And we have Councilman Squilla.
Yeah, they said he was here.
So now, Doctor, you have to come up too. Yeah, we kind of need you. Yeah. Thank you. Thank you, sir.
Thank you, Mr. President. This is an extreme honor. When we heard that Dr. Evans was moving on, not only I said, oh no, but all my staff said, oh no. He's been so open and responsive to all of us. It doesn't matter who you are, what your title is. And so I start calling him not only for his department, but for health and for anything I could think of. And he's always been there. So we certainly will miss him. And I don't know how we'll do to survive. I guess I have to learn who's supposed to do what and do the right thing and refer to the right people. But we certainly appreciate him. We thank him. We see him at many affairs because he's just that kind of person. And it is with great pleasure and honor that we present him this resolution. Resolution honoring and recognizing Dr. Arthur C. Evans for his accomplishments and numerous contributions to the city of Philadelphia on the occasion of his retirement from the Department of Behavioral Health and Intellectual Disability Services, and congratulating him on his appointment as CEO of the American Psychological Association.
Whereas Arthur C. Evans, Jr., PhD, holds a doctorate in clinical community psychology from the University of Maryland and a master's degree in experimental psychology from Florida Atlantic University, where he also completed his undergraduate work.
Whereas Dr. Evans is the Commissioner of Philadelphia's Department of Behavioral and Intellectual Disability Services, DBHIDS, a $1 billion healthcare agency that is the behavioral health and intellectual disability safety net for more than 1.5 million Philadelphians. And
whereas the department has undergone a system-wide transformation under the leadership of Dr. Evans. Improved outcomes for people assessing services has resulted in fewer inpatient admissions, visits to crisis centers, and significant cost savings that the city has reinvested in community-based services and supports. And
whereas prior to his work in Philadelphia, Dr. Evans was the Deputy Commissioner for the Connecticut Department of Mental Health and Addiction Services, where he led major strategic initiatives for the Connecticut behavioral health care system. He played a significant role in implementing a recovery-oriented policy framework, addressing healthcare disparities, and increasing the use of evidence-based practices, leading-edge research, and community engagement. And
whereas Dr. Evans holds faculty appointments at the University of Pennsylvania School of Medicine and the Philadelphia College of Osteopathic Medicine, and has held faculty appointments at the Yale University School of Medicine and Quinnipiac University. And
whereas Dr. Evans has been recognized nationally for his work in behavioral healthcare policy and the transformation of service delivery systems. In 2015, he was recognized by the White House as an advocate for action by the Office of National Drug Control Policy, and
whereas in 2013, Dr. Evans received the Dr. Nathan Davis Award for Outstanding Government Service, the American Medical Association's Top Government Service Award in Healthcare for his leadership in transforming the Philadelphia behavioral health system, particularly around the adoption of a public health approach, and
whereas Dr. Evans has served in several national leadership roles, including Chair of the Federal Substance Abuse and Mental Health Services Administration, Partners for Recovery Initiative Steering Committee, Co-Chair of the National Action Group on Fostering System Reforms for Adults with Serious Mental Illnesses, member of SAMHSA's Center for Substance Abuse Treatment Advisory Committee, Chair of the National Advisory Committee for the Robert Wood Johnson Foundation's Pathway to Recovery Project, and President of the Board of Directors of the New England Institute of Addiction Studies, Board of Directors for the Melville Charitable Trust, the nation's largest philanthropic focused exclusively on ending homelessness, and
whereas, with a proven track record of innovative and effective solutions to complex system changes, Dr. Evans brings diverse training and experience as a scientific practitioner and policymaker. He is in high demand as a resource for his fellow psychologists, healthcare administrators, and community, service, and government leaders. And an adept and versatile public speaker, Dr. Evans speaks to behavioral health leaders and organizations across the country, and
whereas in January 2017, Dr. Evans was named Chief Executive Officer of the American Psychological Association, APA. Dr. Evans will assume his position there on March the 20th. As CEO of the APA, Dr. Evans will head the leading scientific and professional organization representing psychology in the United States, with more than 117,500 researchers, educators, clinicians, consultants, and students as its members.
Now therefore, be it resolved that the Philadelphia City Council hereby honors and recognizes Dr. Arthur C. Evans for his accomplishments and numerous contributions to the City of Philadelphia on the occasion of his retirement from the Department of Behavioral Health and Intellectual Disability, and congratulates him on his appointment as CEO of the American Psychological Association. Further resolved that an engrossed copy of this resolution be presented to Dr. Evans as sincere expression of the Philadelphia City Council's gratitude and recognition. Thank you.
Thank you. And the chair recognizes Dr. Evans for remarks.
First of all, I am so honored, and I just can't tell you how much I appreciate all of you for standing here and recognizing me in this way. But I'm very clear that any success that we've had as a department depends on the people that I work with every day. And a few of them came today. We're about 700 strong, but I want all of them to stand up. Everyone from the Department of Behavioral Health and Intellectual Disability Services, could you all stand up? And could we give them a round of applause? These folks do a tremendous job for the citizens of Philadelphia, and I'm forever indebted to them. I remember my first testimony in City Council, and back then I went last after all of the human services organizations and right before lunch. And so by the time you all would get to me, I would be sitting there just crossing out my testimony. So by the time I got to the end, there was literally one person left, and that was whoever was chairing. And I was standing between that person and lunch. And so I would, do one paragraph and ask if there were any questions, and then, invariably the person would say, "Nah, we're good," and that was it. To today, where I think my record is 3.5-hour testimony, and that shows a remarkable change and understanding of the importance of behavioral health issues in the city. And so I'm so grateful to you all. It sharpens us when you ask us tough questions, when you probe us, when you question us, and I want to thank you all for, I know that sounds a little sadistic, but I do want to, or masochistic I should say, but it does help us when we go back, because we take what you ask us about, the issues that your constituents bring to you, and we go back and we try to work on those problems, so I want to thank you for that. I have with me some of my family members, so I want my parent-in-laws to stand up. They're all the way from Grand Bahama, Freeport, Grand Bahama. They said, come on up for the picture, come on up for the picture. I have one of my daughters who's representing my 3 daughters, Akila, come on up. We call her the knee baby. And I have my partner, a life partner for 30 years, 32 years, 31. I knew that. Word to the wise, never go to the numbers. But my wife, Claudine, who's also here with me as well. Finally, I just want to thank all of the people that have supported our agency. We don't do this work in isolation. We have providers, and I think there's some providers here and people in the community. And one of the things that I am most proud of in my tenure, there are a couple of things. One of them is that we have worked extremely hard to make sure that people who live in the margins get the best services that they possibly can. We go out and we get the best scientists in the world, and we partner with them to make sure that people who have Medicaid and people who are uninsured get the best services. And I can tell you that people in Philadelphia get services that are comparable to what you could get, and in many cases better, because we're working with the creators of some of those practices. But the other thing that I'm enormously proud of, and I have many staff here who've done this, is that we are reaching into the community and not just waiting for people to show up, but going into communities and connecting with people. And I think that makes a huge difference, particularly for issues that are as stigmatized as mental health and addiction and intellectual disability. So I want to thank all the people that partner with us, our sister agencies, this council, and certainly the mayor. And I've worked for 3 mayors, and I've had the opportunity to serve under 3 administrations, and each one of them understand the importance of what we do and have supported us. So thank you all very much. I appreciate you, and you all can't get rid of me. I'm still going to be connected to Philadelphia, so thank you.
Councilman Biddies.